everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm a general dentist with a practice dedicated to taking care of patients with TMJ disorders. Today's video is about tongue tie. Tongue tie and TMJ disorders are related, and I can see that clearly in my practice. Today's video specifically is just about what a tongue tie is, and I'll be releasing more videos in the future. So if you want to know how tongue tie is related to TMJ problems, if you want to know why your children grind their teeth at night or are restless sleepers, why your children are picky eaters, how this can be related to sleep apnea and mouth breathing, it's all connected, and I have so much to share with you guys. So this video will keep it basic, but if you're interested in this and all the rest, please subscribe to my channel. Click like below. There's so much more to come, and I have so much great information to share with you guys. So let's get right into it. What is a tongue tie? A lot of us are taught to believe that people with lisps or really strong speech disorders are the only ones with tongue ties, and that's just not the case. Tongue ties are a lot less obvious and a lot more common than we are taught to believe. Underneath all of our tongues is a band of tissue called the frenum or the frenulum. This band of tissue tethers the tongue to the floor of the mouth. So all of us have a frenum, but not all of us have tongue ties. A tongue tie occurs when this band of tissue is restrictive. It's too tight, and it actually negatively affects nursing, chewing, speaking, swallowing, breathing, and proper tongue position. What is proper tongue position? Proper tongue position is when the entire tongue, the tip, the middle, and the back, is up against the roof of the mouth with a light suction. So the tip of the tongue should be resting against the little pad of tissue that's right behind our front two teeth on the top. And then the rest of the tongue should also be up against the roof of the mouth, again, with a light suction. There are 4 classes of tongue tie. Classes 1 and 2 are generally easier to diagnose because they're very visible. So that means when the frenum, or that band of tissue, is very close to the tip of the tongue, at the tip of the tongue, or 2 to 4 millimeters behind it. So pretty obvious, easy to diagnose, and these are called anterior tongue ties. Classes 3 and 4 are harder to diagnose. They have to be diagnosed by not only seeing the tie, but feeling it with a finger and feeling the restriction that it may be causing. These are typically called posterior tongue ties and are not as obvious and harder to diagnose. Some will say that posterior tongue ties don't exist, which I disagree with. A lot of these people that will say this, unfortunately, are pediatricians, and in my humble opinion, they should be amongst the first to diagnose these because it can help so much with the mother-baby nursing duo. Additionally, an anterior tongue tie cannot exist without a posterior tongue tie. So basically, if it's tight in the front, it's tight in the back. All 4 classes of tongue tie can negatively affect nursing, chewing, speaking, swallowing, breathing, and proper tongue position. Proper tongue position, again, with the entire tongue up against the roof of the mouth, is essential for development of the roof of the mouth, stimulation of cranial nerves, and release of growth hormones and endorphins. Additionally, tongue ties will tie up the genioglossus muscle, which is a main muscle that's involved in mobility of the tongue. So that's why nursing, chewing, speaking, all of that is affected so much. With this main muscle being tied up and not allowed its full mobility, it's restricting the tongue's movement to do all of those things that it should be able to do. I will be releasing separate videos on tongue tie and TMJ disorders, tongue tie and nursing, and tongue tie and breathing. For more information in the meantime, please pick up this book if you have time. It is called Tongue Tied by Richard Baxter, and it is amazing. The first time I read it, I felt like a whole new world had been opened up to me, and it was a big part that I had been missing in my training in dental school and afterwards with all the CE courses that I took. So this book is wonderful. It's written by Dr. Richard Baxter, and I will be linking it below. So go ahead and take a look at it when you guys have some time. If you've learned something or if you liked what you've heard, please click like below, subscribe to my channel. There's so much more to come. Thank you.